स्क्रीनिंग कर दिया है. अब हो गया स्टार्ट शायद. देखिएगा.
हो गया
हो
मैम.
गया. चलिए. थैंक्स. Hi everybody. So today we are here for cervical cancer vaccination. Thank you so much for waiting. Again some system problem. Yes. So last class May I saw there were a lot of requests that since we covered screening, which is very important, one of the potential question for good evening everyone, one of the potential question for the exam. Why? Because a lot of uh, social drive is going on for for screening every woman. Similarly, the social drive is going for vaccinating every girl. So we should know as a medical professional that little detail about vaccination. ठीक है. These things which are going too much in the society at the ground level, that is something which we have to understand. ठीक है. So what about cervical cancer vaccination? What are we gonna read? We will read that, pardon my writing for now because I have forgotten my pen, but I'll try to write it clearly. Good evening everyone. We will read about the types of vaccine. How many types of vaccines are there? I'll see if I can type something of it. How many types of vaccines are there? We will write the types of vaccine. I think let's not just write. About after seeing the types of vaccine, we will see the age when it should be started. What is the starting age of the vaccine? That we will see. What is the starting age? Okay, just listen. So next we will see at what age the vaccination should be started, and then we will see against which cancers, which all cancers it protects us, and what is the age when we should stop the vaccination. So basic things only we have to understand. Okay, the types of vaccines, when to be started, when to be stopped, and the protection against which cancers, how it is to be followed. Starting with the type of vaccines. If you're okay, I can work on this so that I can type everything. Right? Okay, is this screen okay? If my voice is audible, please everyone let me know. Let's first talk about the types of vaccine. In our country, right now, there are 4 types of vaccines that are available. Okay? If my screen is clearly visible, everyone let me know. I have tried making it as visible as possible. Yes. ठीक है. So the types of vaccines are 4. सबसे पहले जो launch हुई थी, the first one that was launched was Cervarix. That was the first vaccine that was launched, and this vaccine was bivalent. Bivalent matlab it used to protect us against 2 HPV cancers. Which one? HPV 16 and HPV 18. The most dangerous one this vaccine covered, HPV 16 and 18, Cervarix. Then came Gardasil. Gardasil was different. How? It was quadrivalent. Along with protecting us against HPV 16 and 18, it also protected us certain simple HPV, that is 6 and 11. Okay, that is why the name was given quadrivalent, and it is important to know this difference between Cervarix and Gardasil. You'll know why I'm stressing on that. Cervarix was bivalent against 1618, which is the most cancerous HPV. Gardasil was quadrivalent against 611 and 1618. 1618 caused cervical cancer, but 611 caused genital warts. ठीक है. Genital warts, whosoever get recurrent genital warts, they are at risk of anal cancer also. They are at risk of penile cancer also. They are at risk of laryngeal cancer also. ठीक है. So this was quadrivalent. The recent one that has come is Gardasil nonavalent. As the name signifies, it is for against how many HPVs? It is against 9 HPVs. Against 16, 18, 31, 33, 45, 52, 58 and against 6 and 11. These are the 9. Do you have to remember all the 9 strains? No, you don't have to. But remember the 4 strains which are most important: 16, 18, and 611. This is Gardasil nonavalent against 9 cancer, against 9 HPVs. One of the most recent advances in our country is Cervavac. It is an Indian vaccine. Cervarix and Gardasil are US made vaccines and they are pretty costly. Gardasil cost almost 9,000. Everyone can't afford it. Similarly, Cervarix was also almost 3,000 to 4,000. But then Cervavac was launched. Cervavac is from Serum Institute of India. It's an Indian vaccine. It is also a quadrivalent vaccine. Important is Cervavac is very cost effective. That is why now government is starting a new protocol. They are trying to bring Cervavac into the vaccination schedule of the girls. Because now we have got our own vaccine which is very cost effective. Okay, so which is the Indian vaccine? Cervavac. It is how many valent? It is quadrivalent. The only bivalent vaccine is Cervarix. Okay, which is the nonavalent vaccine against 9 strains? Gardasil nonavalent. This information is clear to everyone? Okay, now why I am stressing it again so much? What I want to stress on is that 6 and 11 protect you against genital warts. And genital warts carry the future risk of penile, yani penis cancer, and the anal cancer, and the laryngeal cancer. But if I talk about other strains like 16 and 18, they will protect a woman against cervical cancer, vaginal cancer. So a lot of cancers are protective. It is against protective. Vulval cancer. Now, if I ask you which of the following vaccines will be helpful in boys, what will be your answer? If I give Cervarix to boys, which is protective only against 16, 18, which cause cervical, vaginal and vulval cancer, will Cervarix helpful in boys? No. Cervarix is not recommended for boys. If we have to give HPV vaccine in boys, we have to choose among Gardasil or Cervavac. So 16-18 vaccine is not helpful if you give it in boys. Boys don't have cervix, they don't have vagina and vulva. But yes, if you give quadrivalent vaccine which will protect them against warts, that will protect them against penile cancer and anal cancer. Okay? Got it, everyone? That is why I was stressing that which vaccines are I've many times seen which of the vaccines is recommended in boys, all of them. No. Only Gardasil quadrivalent, Gardasil nonavalent and our vaccine Cervavac are recommended in boys. Cervarix was never for boys. It was only made for girls. Okay? So is HPV cancer vaccine for both girls and boys? Yes. This vaccine is for both girls and boys. Okay? This is very clear that both girls and boys have to be given the vaccine. Why girls and boys? It is always beneficial if you give HPV vaccine before they become sexually active. So it has to be given in young girls and boys before they become sexually active, before they become exposed to HPV. Once they become sexually active and they get exposed to HPV, then the efficiency of this vaccine reduces. So you should always give it in young girls and boys before they start having a sexual activity. Okay? Yes. So in National Immunization Schedule, the government is introducing Cervavac soon. Not yet, but yes, in this budget they have said they will introduce Cervavac and it will be for girls and boys both. जब Cervarix आया था, it was only for girls. Because it is not protecting you against the penile cancer and anal cancer. It is protecting you only against cervix, vagina and vulva. So it was not beneficial for boys. But now these new vaccines have to be given in boys also. This much is clear? This vaccine? Okay, now what is the starting age for both girls and boys? What is the starting age where you can start giving the vaccine? 9 years. There should be no confusion in that. 9 to 10, 9 to 11. It's not a range. When should vaccine be started? When can you ideally give a vaccine? After 9 years, you can give any time. So 9 year is that point when you start vaccination. So young. I told you why young, because it is most beneficial when you give it before a person becomes sexually active. So you give vaccination in young children. ठीक है? So starting age is 9 years in everyone. Now how it has to be given? So the dosing schedule, what is the dosing schedule? Now there are two dosing schedule. If you go for the most recommended schedule. So now since you can be asked any of these two schedule you should know. The most recommended schedule is up from 9 to 15 years. From 9, remember this 15 wala number, till 15 years. So 9 years याद रहेगा starting age है. Remember till 15 years I will give 2 doses. Till 15 year I will give 2 doses which are 6 months apart. 2 doses 6 months apart up till 15. If a person is more than 15 years, now it's a grown up child. Here I will need more doses. So after 15 years, I will give 3 doses. And that is 0 after 1 month and then after 6 months. So from 9 to 15 years, 2 doses. After 15 years to everyone, 3 doses. 0, 1 and 6. Up till what age it has to be given? In girls, it can be given up till the age of 46 years. But in boys, it should be stopped at age of 26 years. So in ladies, up till 46 years also you can give it. Even though they become sexually active. If a girl is sexually active, if a boy is sexually active, can you give HPV vaccine? Yes. I agree, efficiency will be reduced, but it is not 0. So even if you are a sexually active, suppose somebody decide to get vaccinated at 20 years and she tells she is married, will you not give it? You will give it. Explaining that efficiency is reduced since you are already exposed to HPV, since you are already sexually active. ठीक है? Up till age of 46 years, a women can be given vaccination. But boys has to be given vaccination up till age of 26 years only. ठीक है? I have written more than 15 years मतलब 16 and more than 16. लो बेटा चेंज कर दिया. ठीक है? Okay. So what is the starting age? Please everyone speak up with me. Don't talk among yourselves, Shreyadi, but speak up with me. What is the starting age for both girls and boys? 9 years. What is the dosage? Up till 15, 2 dosage, 6 months apart. After 15 years, this is a grown-up child now. I'll give 3 doses, 0, 1 and 6. Up till what age it is allowed to have vaccination? In women up till 46 years, in boys up till 26 years. Which vaccine can be given in girls? All of them. Cervarix, Gardasil, Cervavac. Which vaccines can be given in boys? Gardasil and Cervavac, not Cervarix. So bivalent vaccine cannot be given in boys because it will not be of any use. It will not protect him against anything. ठीक है? Okay? You were speaking loud with me. Only if you will speak up loud, then only you will remember it. The starting age, the stopping age. Okay, I know. You know stopping age for girls and boys, right? The vaccines which is the only bivalent vaccine? Which is the only bivalent vaccine? Cervarix. That is the only bivalent. Can it be given in boys? No. What are the other vaccines? Quadrivalent vaccines. Tell me the quadrivalent vaccines. Quadrivalent are Gardasil is also quadrivalent. Cervavac, our Indian vaccine, is also quadrivalent. A new vaccine has come, costly one, Gardasil non-avalent. All these can be given in girls and boys both. ठीक है? So this is the usual schedule. Now question can be asked because examiners love asking questions according to the WHO recommendation. See, WHO बना है for countries who are what we say, who are not very well off. So WHO always make recommendations even for countries, the third world countries, who can't afford these 3 doses. वो कहेंगे यार हमारे लिए this is also very costly. So WHO has given a SAGE recommendation, and question can be asked according to WHO SAGE recommendation. We also call it low dose regime. So if nothing is written, what is the schedule for HPV vaccine? You will write down what we have learnt. But if the question comes, what is the WHO low dose recommendation? What is the SAGE recommendation? Because it is a worldwide recommendation, especially for countries who can't afford this much also. उनके लिए है लो डोज रजीम. लो डोज रजीम क्या कहती है? स्टार्टिंग एज इज सेम, स्टॉपिंग एज इज सेम, बट दे से फ्रॉम 9 years to 20 years you give 1 or 2 doses. मतलब even 1 dose is okay if you want to take 1 dose. So either take 1, those who can afford take 2. Anything is okay, but at least take 1. So 1 or 2 doses from 9 to 20 years. But they say that if you are beyond 20 years, then you have to take 2 doses. Then there is no 1 or 2, then there is 2 doses. They have removed 3 doses. They said we can't afford that much. Remove 3 doses. Difference समझ में आया? WHO make its recommendation so that every country can afford it. So WHO की HPV recommendation को हम SAGE recommendation कहते हैं. By this name the question can be asked. SAGE recommendation, also called low dose recommendation. What it is, that up till 20 years either 1 dose or 2 dose. But after 20 years 2 dose. Till 46 years. There is no 3 dose here. But if nothing is asked, if the finance is allowed, if question doesn't mention low dose recommendation, SAGE recommendation, if question doesn't mention, then mention this schedule, which is the most recommended one. What is the most recommended one? Now, close your eyes. Please close your eyes. 9 to 15 years, 2 doses. 15 to 46 years, 3 doses. But what is the low dose schedule? Please again close your eyes and repeat with me. What is the low dose schedule? 15 नहीं है इसमें. अब इसमें border है 20. 9 to 20 years, 1 dose or 2 dose. Beyond 20 years, 2 dose. Confusion? Any problem? Just like हमने स्क्रीनिंग में क्या पढ़ा था? Screening was done in a good resource country. If you remember, I even have that class right now. Do you remember this screening in good resource area and poor resource area? था ना? Good resource के लिए best was HPV. Poor resource के लिए भाई अगर HPV नहीं है तो viable है. Same. And you ask me, ma'am, if nothing is mentioned, what is the best test for cervical cancer screening? If they have not mentioned which area is it, you will always write down HPV screening is the best test for cervical screening. But in case they mention, similarly here if they mention what is the low dose regime, what is the WHO SAGE recommendation, you should know there is a low dose regime also. SAGE, आपको full form ज़रूर पूछनी थी, मुझे लग रहा था. SAGE was that committee, I've forgotten the name, you will Google it, you will find it. It was कमिटी अगेंस्ट कैंसर ग्रुप करके कुछ नाम है इसका. साइंटिफिक अमेरिकन सोसाइटी अगेंस्ट कैंसर, इट इज़ समथिंग लाइक दैट कमिटी हु मेड दैट रिकमेंडेशन, दैट इज सेज. ठीक है. अब लास्ट चीज़ आप मुझे बताओ, यू टेल मी, व्हाट अबाउट HPV वैक्सीन इन प्रेगनेंसी? You tell me. What about HPV? Do we give HPV vaccine in pregnancy? Do we give HPV vaccine in pregnancy? You all answer me. What all of you have known? What do we give HPV vaccine in pregnancy? Okay, more answers. Prognosis पे effect आएगा बेटा. Good question. It will be affected. If you are giving lesser dose, efficacy will be less. Similarly, if you are giving it in a already sexually active person, the efficacy will be less. But at least have something. Efficacy is reduced, still you have to give the vaccine. No, very good. HPV vaccine is not given in pregnancy. Why? ये तो live vaccine नहीं है. It is not a live vaccine. Then why I can't give it in pregnancy? Pregnancy में I can't give live vaccine, है ना? This is not a live vaccine. HPV vaccine is made up of components L1 and L2. L1 and L2 उसके core के components हैं. It is not a live vaccine. Then why I can't give it? There is not enough research yet. In pregnancy, HPV vaccine has not been researched. That is why it is not recommended. So suppose somebody started her schedule before pregnancy. Before pregnancy, she started the vaccination. At her next dose, when she came after 6 months for the next dose, she found out she is pregnant. Now what will you suggest? After she came to you for the second dose after 6 months and you found out she is pregnant, what will I advise her? She was following her schedule but she became pregnant in between. I will advise her not to take vaccine in whole pregnancy and take the next dose in postpartum. So I'll tell her, now your dose that will be missed, it's okay, you can miss it for up to 2 years, no problem, but next dose you take it once you deliver. So does that mean I can give HPV vaccine in lactation? Yes. It is not gonna affect the lactation. ठीक है. SAGE की full form है Scientific Advisory Group of Experts. So I told you that committee that made the recommendation, that is SAGE, Scientific Advisory Group of Experts. ठीक है. This is the vaccine. इतना simple. अब वैक्सीन के बारे में पता होना चाहिए because we will be the people who will be giving vaccine, who will be telling, if somebody will ask vaccination about her girl, what will we tell them? If they ask, I want my boy to be vaccinated, हमें पता ही नहीं है boys में देते हैं नहीं देते. We don't know कौन सी वाली देते हैं. ठीक है. So how many types of vaccines are there? Please revise. 4 vaccines are there. ठीक है. Cervarix bivalent, Gardasil quadrivalent, Gardasil nonavalent and Cervavac. Which is the Indian vaccine? Cervavac. ठीक है. Very cost effective. Which of these can be given in boys? We can give Gardasil, both of them. We can give Cervavac. Bivalent vaccine not given. Which of these can be given in girls? All of them. They are made for girls. ठीक है. They protect against what? The quadrivalent vaccine protects us against cervical cancer, vaginal cancer, vulval cancer, genital warts. It protects us against genital warts. Hence, it protects against penile cancer, anal cancer and laryngeal cancer. ठीक है. You are revising with me. You are speaking up with me. You have to speak up. अब बस बैठ के सुनना नहीं ऐसे करके. Speak up. What is the starting age for girls and boys? 9 years. What is the stopping age? For girls 46 years. For boys 26 years. ठीक है. Schedule. I am not mentioning low dose. What is the schedule? Schedule is, close your eyes please. Up till 15 years, 2 doses, 6 months apart. After 15 years, 3 doses. ठीक है. In an immunocompromised person, irrespective of age, 3 doses. ठीक है. If the question asked, if it is a very vulture type of examiner, then they will ask what is the WHO SAGE regime, what is the low dose regime. Okay, there is a low dose regime. Here, up till 20 years, 1 dose or 2 dose. After 20 years, 2 dose. Can I give it in pregnancy? No. What will I tell women? I will tell, come into postpartum, I'll give the vaccine in postpartum. Is it a live vaccine? No. Then why am I not giving it in pregnancy? Because we don't have enough researches. ठीक है. बॉयज़ को कौन सी देनी है बच्चे? यू कैन गिव all of them to boys which have been colored in blue. Cervarix सिर्फ 16-18 को प्रोटेक्ट करता है. इट इज़ अगेंस्ट ओनली 16-18. इट प्रोटेक्ट्स ओनली अगेंस्ट वजाइनल कैंसर, सर्वाइकल कैंसर एंड वल्वल कैंसर. So it is not helpful for boys. But all other 3, 2, 3, 4 which I have colored, they protect against penile cancer, laryngeal cancer and anal cancer. Lactation से कोई इफेक्ट नहीं होता ऑफ HPV वैक्सीन. इट इज नॉट पास्ड इनटू लैक्टेशन. Yes, Gardasil and Cervavac are given in boys. Correct. सबको याद हो गया? Everyone is okay now? ठीक है. जब when I'm speaking, speak up with me everything loudly. अभी भी मैं क्लास बंद करूंगी तो स्टार्टिंग एज, लो डोज रिजीम, नॉर्मल रिजीम, ये याद रखना है. ठीक है. ओके. Any question regarding for which cancer, which vaccine response? No, I told you against which they are asked. Okay, the dose is 0.5 ml IM. It is given IM 0.5 ml. ठीक है. Is it refrigerated? Yes, it is refrigerated. Important, it is refrigerated at a temperature of 2 to 3 degrees centigrade. Means it is kept onto the door of the fridge. It is never frozen. You don't freeze it. There are only few vaccines that are frozen. You should know the vaccines that are frozen. जैसे OPV को frozen करते हैं, freezer में रखते हैं. MMR को, varicella को, they are frozen. HPV is never frozen. It is kept in the door of the fridge at 2 to 3. Immediately after taking out, you use it. You don't wait. Once you take it out of the fridge, you use it. ठीक है. So it is not one of those which has frozen. If you have taken Cervarix, the schedule has to be completed with that vaccine only. You can't do that one dose you have taken of Cervarix, other dose of Gardasil. No. Because though it is against similar strains only, but the constituents and the other, preservatives that are there in vaccine that are different for all of them. So schedule has to be completed for that particular vaccine only. ठीक है. Okay everybody. चलो, I take your leave now everyone. Yes, if the vial is open you can't use it. That's true for this also. That is true for any vaccine. Now this was a topic that was suggested by you all, and I agree it was a good topic. In any short topic you want me to do again, just like this one, it was a very short topic of 25 minutes. If you want any other similar topic, please let me know. I would love to do it. ठीक है. Okay Bedbu. Okay everyone. So let me know in case you want another similar topic. Just give me in the messages, right? Okay, so I take your leave. You have given a topic? No. 0.5 ml IM, beta. 0.5 ml IM. Okay? Rogam, you want to take up Rogam? Rogam अलग से नहीं ले सकते. I can take RH negative pregnancy पूरा, है ना, of that part, but अलग से सिर्फ Rogam के बारे में कुछ नहीं है. Labor 3 stage. अच्छा, हाँ, right. Yes, beta, it follows open vial policy. Yes. It's effective, no? I can take HIV in pregnancy. Perfect. Updated PPH. Perfect. I think we'll take few more sessions on HIV in pregnancy and updated PPH. Thank you for telling me very good topics. ठीक है? We will keep doing the